We pass out condoms as well. Our rule is we ask that a person be at least 13 years of age before we pass them out. But yes, we do.
What's the percentage-wise of numbers in terms of the high prevalence of young people that start out with just STDs and then it respond to other things? I mean, we have widespread problem of chlamydia and other kinds of problems, and the increase of now more of syphilis and gonorrhea and other kinds of things that sometimes young people think that medicine, penicillin will take away, but you got something now that none of those medications will get rid of them. And they just, especially in an age where they, they're indispensable anyway, that, it's not gonna happen to me. Happen to everybody else, but it's not gonna happen to me. And, the impact of those kinds of numbers in our community. Do you see prevalence of a lot of them with that, and then, because they don't change their lifestyle, they don't change their habits, it leads on to something else, or other kinds of things.
Statistically, here in the state of Indiana, you can go in any high school in the state of Indiana, and 1 out of every 3 teenagers has or has had an STD. But when it comes time for us to do our presentations in schools, because Indiana is an abstinence-based state,
Right.
we're talking about abstinence, which I don't know if it's too late. Because
Well, I mean, that's the only conversation that you can have.
That's the only conversation.
To have, and you're not gonna get that, you're not gonna go into Bishop Louis Supreme and say anything.
Yeah. But I also do a program with women. I go into housing communities, Eden Green, McCormick, and what I do is I do a program with mothers, and I teach those mothers, one, that most of the time, this is not what we tell our children, but what we show our children. So that's important.
Yeah.
That's so good.
Yeah.
And I also talk to those mothers about ways to communicate with their children
Yeah.
about HIV, STDs, and keeping those doors open, and knowing that you're going to hear some things, but you still have to be open and talk with your children. 1 in every 3, that's a lot. And as I said earlier, we also have an STD clinic. It's our African American children that are coming in there in need of services.
Yeah, the reason why I say it because I worked for Fort Wayne Community Schools for a lot of years, and
Wow.
part of it as administrator, I was working with the Expected Mothers Program, and of course it was limited to just high schools because they wanted to continue to get credits toward graduation, but it never fails that every year we got a lot of calls, and it was one year I think we had a situation where there was a 11-year-old that didn't realize that she was, 4 months along, a 5th grader. So what I'm saying is, education, we think that a lot of times our kids are aloof, but they are engaged in these promiscuous activities earlier and earlier. I had 2 sisters, but I don't know when mom gave it, but I know it was like, they were teenagers, but I think education-wise now, you need to almost start in third, second,
I would
third
say
grade.
there are statistics, there's a report that's out that shows that our children at the age as early as 9 are having sex, and that's what that's over.
I mean, you say, okay, and this is reality, folks, because, with the high processed food and all of that, you got young boys at 8 got, peach fuzz, they got mustache, and I don't know what the untold statistic on young ladies that's, starting the onset of the womanhood, as much as 7 or 8 years old, just the need for wholesome education that they don't get from the street.
Somewhere.
This is what this is, not from the street, but somebody's helping them to understand that. Yeah, this part is not referred to as this or that, but
Right, that's where it's coming.
somebody need to help them, and a lot of times mothers don't have the information that they need, because mother was 14, she had me, and then I just got 13.
But what the mothers tell me is they don't want to talk to their children about sex because they feel if they talk to them about it, they're going to want to have it.
But they already.
But they're having it anyway.